Assalamu alaikum students. In my previous lecture I talked about mutations and mode of inheritance. Today I will discuss somatic chromosomal disorders. They can be of numerical type and structural type. Numerical type includes aneuploidy or polyploidy, while structural anomalies include translocations, inversions, deletions, insertions, reinformation and isochromosome. Just a brief review. What is duplication? Duplication is where segments of chromosome are duplicated. Here purple and green part is duplicated. And in deletion, part of chromosome is deleted. While inversion shows flipping of the segment of chromosome break off, flips over and reattaches. And in translocation, there is transfer of segments of chromosome between two different chromosomes. Translocations. Balanced reciprocal translocation results in equal length of chromosome. There you can see here part of red chromosome is transferred to blue chromosome and blue chromosome transferred to red chromosome. Result is both the chromosomes are of equal length. While in Robertsonian translocation, segments of chromosomes are transferred between two chromosomes and the result is one very long chromosome and one short chromosome. This short chromosome got redundant gene and it gets lost. Isochromosome are the result of horizontal division of the chromosome. So the result is either the chromosome is having both short arm or both long arm. In deletion, part of the segment is deleted and the length of chromosome gets shortened. Inversions is of two types. Paracentric doesn't involve centromere, while pericentric involves centromere, and the segment breaks off, flips over and reattaches. Here you can see red part is inverted to yellow part. Ring chromosome results when the ends of chromosome are deleted and then they fuse together to form ring. Numerical abnormalities. In humans, normal chromosome count is 46. That is 2n is equal to 46. Exact multiple of haploid is called euploid, while chromosome having number 3n or 4n are called polyploid. Any number that is not an exact multiple of n is called aneuploid. Chief cause of aneuploid is non-disjunction of homologous pair of chromosome, while mosaicism is the term used to describe the presence of two or more population of cells with different complements of chromosomes. Here you can see the process of non-disjunction. Here tetrads cannot separate during meiosis 1 and after meiosis 2, either the cell is having one extra chromosome or one less chromosome. Karyotype is photographic representation of chromosome where chromosomes are arranged in order of decreasing length. You can see here there are 22 pairs of autosomes and 2 sex chromosomes, one X and Y in males and double X in females. Cytogenetic disorders involving autosomes. They are Down syndrome, Edwards and PATAU. In Down syndrome, there is trisomy 21. You can see here 21st chromosome, there are 321 chromosomes. There is the patient of Down syndrome with slanting ear, low set ears and protruded tongue. Down syndrome characterized by extra copy of genes on chromosome 21 is the most common disorder. About 95% of patients have trisomy 21, so their chromosome count is 1 plus 47. The most common cause is meiotic non-disjunction. The parents are normal, while maternal age has a strong influence on the incidence of Down syndrome. Karyotyping shows one extra chromosome 47XX with one 21st extra chromosome. Translocation type includes translocation between chromosome 14 and 21. Mosaic type include 4 types of population with normal and with one extra autosome. Physical signs include decreased muscle tone at birth, excessive skin at the nape of neck, flattened nose, upward slanting eyes, small ears, small mouth, wide short hand with short fingers, separated joints between bones of skull, single palmar crease and white spots on colored part of eye. You can see here, child with Down syndrome have single palmar crease, while in normal patient there are 3 prominent creases. Clinical features include mental retardation, growth retardation, congenital heart defects like AV canal defects, ventricular septal defects, and atrioseptal defects. Ophthalmic disorders include congenital cataract, glaucoma. Patient can have epilepsy. GI malformations include duodenal atresia, Hirschsprung disease, and in sometimes patient presents with hypothyroidism. 40% of patients have congenital heart disease. The most common defects is endocardial cushion defect, including atrial septal defect and AV malformations, ventricular septal defects. Cardiac problems are responsible for majority of the death in infancy and early childhood. Childhood with trisomy 21 have 10-fold to 20-fold increased risk of developing acute leukemia. Virtually all patients with trisomy 21 older than age 40 develop neuropathic changes characteristic of Alzheimer's disease. Patients with Down syndrome also demonstrate abnormal immune responses that leads them to serious infection. So, mother with increased age more than 30 years is asked to do triple screening. The serum markers most widely used are alpha-fetoprotein, HCG, and unconjugated estriol. Trisomy 13 presents with microphthalmia, polydactyly, microcephaly, cleft lip, renal defects, and rocker bottom feet. Karyotyping shows one extra autosome, chromosome 30, while translocation is the transfer of segments between 13 and 14. Mosaic type include both normal and one extra autosome. Trisomy 18. Edwards syndrome presents with low set ear, short neck, overlapping of fingers, congenital heart defects, renal malformation, and rocker bottom feet. Karyotyping shows trisomy 18, 1 plus chromosome, and mosaic type include 4 types of population, normal karyotyping and with one extra 18 autosome. 22q11 deletion syndrome. Deletion of genes at chromosome locus 22, long arm of 11 of chromosome 22 give rise to malformations like DiGeorge syndrome. Presents with thymic hypoplasia, diminished T cell immunity, parathyroid hypoplasia, and hypocalcemia. While velocardiofacial syndrome is characterized by congenital heart diseases involving outflow tract, facial dysmorphism, and developmental delay. Moving on to sex chromosome disorder. Klinefelter syndromes cause male hypogonadism. It's named after Dr. Henry Klinefelter. Also named as XXY syndrome, XXY trisomy. Incidence is 1 in 500 to 1000. Unipoid habitus. A body habitus that is tall, slim, and underweight with long bones and long arms. Arm span exceeds height by 5 cm or more. Cossie was raised as a boy but changed lifestyle to live as a girl. She underwent sex reassignment surgery. She became a famous model. Here you can see tall male with features of female, breast development, weak bones leading to osteoporosis, female type pubic hairs. Klinefelter syndrome is a genetic disorder that only affects male. It occurs when a boy is born with one or more extra X chromosome, which causes the boy to produce less testosterone. Due to having an extra chromosome, the male may possibly have physical traits unusual for males. Karyotyping shows one extra X chromosome. Features include enlarged breasts, sparse body hair, small testicle, Patient is less muscular with weaker bones and long legs. You can see here, tall male, tendency to grow few hair chest, breast development, female type pubic hair, and small testicles. As an adult, they look similar to normal males, but they are likely to have health problems like breast cancers and vein disease and autoimmune disorders. They are infertile. They have harder time in reading and writing, but they live normal social life. Genetic testing includes karyotyping, immunosynthesis, and chorionic villus sampling. Turner syndrome is the cause of female hypogonadism. Is due to one X chromosome or has two X chromosomes, but one is damaged. Incidence is 1 out of every 2500 female live birth. So here you can see karyotyping shows absent Y or absent X chromosome. So they have just single X chromosome. Other names are monosomy X, gonadal dysgenesis, X mosaic Turner, and Ulrich Turner. Chromosomal finding is loss of part or all of one X chromosome. 50% of affected children have karyotyping, 45X. Others have various chromosomal abnormalities. 15% are mosaic, so they present both type of population, normal and one less chromosome. 5 to 10% have Y chromosome material. The phenotype is female. Clinical features include webbed neck, low postal hairline, small mandible, broad chest, cubitus valgus, arched palate, hyperconvex fingernails. You can see here, short female with low hairline, webbed neck, shield-shaped chest, widely spaced nipple, short metacarpals, brown spots, rudimentary ovaries. Some photos of patients with webbed neck and shield-shaped chest. Presentations. Cardiovascular abnormalities include bicuspid aortic valves and coarctation. Renal disorders include ectopic kidney, horseshoe-shaped kidney, and obstructive uropathy. While in endocrine system, they can have antithyroid, thyroid peroxidase, and thyroglobulin antibodies. Investigations include chromosomal analysis for short girl, gonadotrophin levels, thyroid antiperoxidase antibodies, ultrasonography for kidney disorders and for rudimentary ovaries, echocardiography for heart defects and aortic or coarctation, and X-ray for bones. Single gene disorders with atypical pattern of inheritance. They can be by triple repeat mutation, by mutation in mitochondrial genes, and alteration in imprinted regions of genome. They do not follow Mendelian pattern of inheritance. Disease is caused by triple repeat mutation. Pathological amplification of trinucleotide repeat cause loss of function like in Fragile X syndrome or gain of function mutation like in Huntington's disease. Most of the mutation produce neurodegenerative disorder. So Fragile X syndrome is the result of loss of familial mental retardation gene 1 function and characterized by mental retardation and abnormal facial features. In normal population, there are 29 CGG repeats, while in the genome of carrier males and females, they can expand up to 4,000 repeats. Diseases caused by mutation in mitochondrial genes are rare. Leber hereditary optic neuropathy is the prototype. This neurodegenerative disease manifests as progressive bilateral loss of central vision that leads in due course to blindness. Genomic imprinting is transcriptional silencing of paternal or maternal copies of certain genes during gametogenesis. Prader-Willi syndrome is the result of deletion of paternal chromosome 15 and is characterized by mental retardation, short stature, hypotonia, and obesity. while deletion of chromosome 15 long arm region 12 cause Angelman syndrome and is characterized by mental retardation, ataxia, seizures, and inappropriate laughter. Here is your assignment. Kindly attempt this assignment and submit. Thank you.